1. What is the first step in the ACLS algorithm for a patient found unresponsive and not breathing normally? A. Start chest compressions immediately. B. Check pulse and begin rescue breaths. C. Call for emergency help and get an AED. D. Deliver 2 rescue breaths. 2. Which medication is recommended for the treatment of ventricular fibrillation or pulseless ventricular tachycardia during cardiac arrest? A. Atropine. B. Epinephrine. C. Amiodarone. D. Adenosine. 3. What is the recommended compression rate during CPR? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. 4. What is the recommended compression depth for adult patients during CPR? A. At least 1 inch. B. At least 1.5 inches. C. At least 2 inches. D. At least 3 inches. 5. During ACLS, how often should rescuers switch roles to prevent fatigue during chest compressions? A. Every 1 minute. B. Every 2 minutes. C. Every 5 minutes. D. Every 10 minutes. 6. Which rhythm is treated with immediate defibrillation? A. Asystole. B. Pulseless electrical activity. C. Ventricular fibrillation. D. Sinus bradycardia. 7. What is the initial dose of epinephrine recommended during cardiac arrest? A. 0.1 mg intravenous or intraosseous. B. 1 mg intravenous or intraosseous. C. 2 mg intravenous or intraosseous. D. 5 mg intravenous or intraosseous. 8. For a patient in stable narrow complex tachycardia with a heart rate of 180 beats per minute, what is the preferred initial treatment? A. Immediate defibrillation. B. Synchronized cardioversion. C. Vagal maneuvers and adenosine. D. Amiodarone. 9. What is the maximum total dose of adenosine for treating supraventricular tachycardia? A. 3 mg. B. 6 mg. C. 12 mg. D. 18 mg. 10. Which of the following is not an indication for synchronized cardioversion? A. Atrial fibrillation with rapid ventricular response. B. Unstable narrow complex tachycardia. C. Ventricular fibrillation. D. Supraventricular tachycardia with hemodynamic instability. 11. What should be done immediately after delivering a shock during defibrillation? A. Check the pulse. B. Resume CPR starting with chest compressions. C. Deliver another shock. D. Administer epinephrine. 12. Which drug can be used to treat bradycardia in ACLS? A. Dopamine. B. Amiodarone. C. Adenosine. D. Lidocaine. 13. What is the recommended dosage of atropine for symptomatic bradycardia? A. 0.5 mg intravenous every 3 to 5 minutes, maximum 3 mg. B. 1 mg intravenous every 10 minutes, maximum 6 mg. C. 0.1 mg intravenous once only. D. 2 mg intravenous bolus. 14. Which of the following is a reversible cause of cardiac arrest that can be treated by pericardiocentesis? A. Hypoxia. B. Hypovolemia. C. Cardiac tamponade. D. Tension pneumothorax. 15. During post-cardiac arrest care, what is the target oxygen saturation range to avoid hyperoxia? A. 85 to 90%. B. 90 to 94%. C. 94 to 99%. D. 100%. 16. Which of the following is an example of a H-reversible cause of cardiac arrest? A. Hypothermia. B. Hypovolemia. C. Hypoglycemia. D. All of the above. 17. What is the appropriate treatment for torsades de pointes during ACLS? A. Magnesium sulfate. B. Calcium chloride. C. Adenosine. D. Amiodarone. 18. Which medication is preferred for refractory ventricular fibrillation or pulseless ventricular tachycardia after the first dose of epinephrine? A. Amiodarone. B. Lidocaine. C. Magnesium sulfate. D. Atropine. 19. What is the most appropriate airway management device for an unconscious patient without a gag reflex during ACLS? A. Nasopharyngeal airway. B. Oropharyngeal airway. C. Endotracheal tube. D. Bag mask ventilation only. 20. When should capnography be used during ACLS? A. Only during intubation. B. To confirm and monitor endotracheal tube placement. C. After return of spontaneous circulation only. D. It is not necessary in ACLS. 21. Which medication can be used to treat anaphylaxis during ACLS? A. Epinephrine. B. Atropine. C. Amiodarone. D. Lidocaine. 22. What is the main goal of therapeutic hypothermia post-return of spontaneous circulation? A. Reduce cardiac workload. B. Improve neurological outcomes. C. Lower blood pressure. D. Treat infection. 23. Which of the following is not a characteristic of pulseless electrical activity? A. Organized electrical activity on ECG. B. No palpable pulse. C. Responds to defibrillation. D. Caused by reversible factors. 24. How often should rhythm checks occur during CPR in ACLS? A. Every 10 seconds. B. Every 30 seconds. C. Every 2 minutes. D. Every 5 minutes. 25. Which of the following best describes the compression to ventilation ratio during two rescuer adult CPR? A. 15 to 2. B. 30 to 2. C. 5 to 1. D. 20 to 2. Advanced Cardiovascular Life Support. The Advanced Cardiovascular Life Support or ACLS certification test is a comprehensive assessment designed for healthcare professionals who manage cardiovascular emergencies such as cardiac arrest, stroke, and acute coronary syndromes. Administered by organizations like the American Heart Association, the test evaluates knowledge and skills in advanced airway management, ECG interpretation, pharmacology, and team-based resuscitation. Candidates must complete a combination of online coursework, hands-on skills practice, and a written exam. Scenarios emphasize rapid decision-making and adherence to current resuscitation guidelines. Successful completion of the ACLS certification demonstrates proficiency in life-saving interventions and is often required for roles in emergency, critical care, and hospital settings. Here are the top 5 beneficial uses of Advanced Cardiovascular Life Support or ACLS certification. 1. Emergency response readiness. ACLS certification equips healthcare professionals with the skills to respond effectively to cardiac arrest, stroke, and other life-threatening emergencies. 2. Career requirement. Many hospitals and healthcare facilities require ACLS certification for roles in emergency medicine, intensive care, and anesthesia. 3. Enhanced clinical skills. The course deepens understanding of arrhythmias, airway management, and pharmacology critical to saving lives. 4. Team leadership. ACLS training prepares clinicians to lead resuscitation teams and coordinate care during critical events. 5. Professional advancement. Certification increases eligibility for advanced roles and demonstrates commitment to high-quality patient care.